Hi, Dr. Hudak at All About Aesthetics, where we're all about you. Today we're going to talk about a subject that is a favorite of mine, and that's fillers. People are often confused about where to use a filler or where to use a neurotoxin like a Botox or Dysport or Xeomin product. Fillers are primarily used from here on down in the face. They are used to treat furrows, to treat folds, to treat fine lines, to treat lips that have become thinned out. The wonderful thing about fillers is they give you immediate results that look better still 3 hours after injected, and better still 1 to 2 weeks after injected. We use different fillers in different areas of the face depending on what it is we are needing to achieve. Where there is a difference from a Juvederm to a Restylane, Belotero, and a Refine or a Define, or a Silk or a Juvederm Ultra XC, or a regular Juvederm or Juvederm Ultra, a Voluma or a Lift, all of those being hyaluronic acids, is they have to do with the viscosity or thickness. When you want to treat something that's a very fine line, we're going to use something with a lower viscosity. When we want to treat something with of a medium depth, we're going to use something with a medium viscosity. If we want something that needs to lift the tissue, we need to use something with a thicker viscosity. Our viscosity is referred to as the G prime. So a very good injector will know not to use just one product on your whole face, but rather to customize the product to what needs to be filled in so that you get proper and natural looking movement and that your face looks in a natural way rejuvenated. So I'm going to show you on Wednesday some nice before and afters. I will also tell you a little bit about longevity. Most people with the medium thickness hyaluronic acid fillers will notice that they tend to last 6 to 8 months. They can last up to a year in some lucky individuals. They can also last as little as just 2 months in people who tend to work out a lot, so their body burns through and breaks it down faster. But the average is 6 to 8 months. The thicker, more viscous type of hyaluronics can last 8 to 12 months. In some lucky individuals, they can last up to 2 years, but the vast majority of people, it's 8 to 12 months. And in the unlucky person who's working out every day and burning through them faster, they may only last 4 to 6 months. And the real thin ones, likewise, it's going to be a smaller length of time that they last. I predominantly inject Restylane because for the price, people get more for their buck. The Juvederm products work beautifully, it's just that they cost more, and if they cost me more, they're going to cost the patient more. Worldwide, the Restylane products are known to be far more in demand than the Juvederm products. Belotero, I'm looking forward to using. A lot of places throughout the world, the doctors prefer the Belotero for its very nice integration with the tissues, giving a nice and natural rejuvenation to the tissue that they're filling in. The problem in America right now is that the Belotero that is available to us does not have lidocaine and anesthetic with it, so it would be far more uncomfortable to get it injected. Juvederm products like Restylane products has lidocaine anesthetic in it. So it's really never been a procedure that while I'm doing it, a patient is asked for any kind of pain relief, numbing cream, cold packs, or anything. It just is almost imperceptible. A little prick at the beginning and the rest of it's easy to go. I do want to mention specifically, a lot of people will say, I just want to get rid of the lines around my lips. You need to understand that the number one reason that we get lines around our lips is that our lips are deflating. When we re-inflate the lips, and I'm not talking about huge lips or duck lips, I'm talking a natural looking fullness to the lips. When we rejuvenate that, generally what you will see is a significant decrease and often a complete erasing of the lines around the lips. So you should always start there. If there's residual deep lines, then we can go ahead and attack those. The outer corners of the lips, if we don't inject those enough, people will get a downward turn, a marionette line. So we always want to address that as well. You never want to go directly into the vermilion border, because that's how you get a duck lip. That's where the lip meets the skin. A fault of many of the injectors out there, and that's why they get those bad results. You want to go into the breadth of the lip. But enough of that. Please tune in so you see us on Tech Tuesday and Wow Wednesday to learn a little bit more about the fillers. Thanks.